It's Mari McInerney from Croaky here at Safer Care Victoria's Giant Steps Conference, and I'm here with one of the keynote speakers from this morning, Dr. Bronwyn King. Bronwyn, would you be able to introduce you and your role?
Sure. So my name is Dr. Bronwyn King. I'm a radiation oncologist and I'm the CEO of Tobacco-Free Portfolios.
And I'm going to make you do a 10 seconds or less almost thing about what led you to that. You had a moment.
I did. So back in 2010, I discovered by accident that my super fund was investing some of my money in big tobacco. And at that time, I was a specialist cancer doctor working at Peter MacCallum Cancer Centre, and to me it made absolutely no sense to be going to work every day trying to help people who were suffering from tobacco-related illness, and then at the very same time have my money invested in the companies that made the products that were killing them.
So you talked about an amazing journey, really, that has taken you from boardrooms, into boardrooms and across the globe, and with to the UN with the President of France, etc., etc. And
just the usual path.
Just the usual pathway. What have you achieved? Where are you now?
Well, I think our flagship global initiative, the one you're talking about, which was launched at the United Nations, was a huge achievement for our tiny organisation led out of Melbourne. And it's called the Pledge, the Tobacco-Free Finance Pledge. And that is an initiative where we reach out to big global mainstream financial organisations, so big banks, big pension funds or super funds across the world, big insurance agencies, and we ask them to reconsider tobacco. Sit down, have a discussion about it, and really ask themselves, does it make sense to continue to lend tobacco companies money, invest in them, and insure them when those companies make products that are on track to kill 1 billion people this century. 1 billion, there's only 7 billion of us. So this is a big problem. And once the finance sector has that discussion, it is very rare for them to do nothing. Most of the time, after deep consideration and a lot of work with their teams, they usually do make the transition to tobacco-free finance. They cut off those relationships with tobacco companies, and in the process, they join part of a global movement where we're really trying to bring an end to tobacco.
You talked about that you've had some pushback from tobacco companies. What are they doing?
Well, of course we expect some pushback, and there's probably more to come that we'll have to get ready for, but in the meantime they have been quite opposed to our work, and most recently they have engaged and unfortunately lured some previously very highly respected executives and thought leaders in the sustainability space. And they
want to name names?
No, I don't. I don't want to name names. We have to be very careful about what we say and remain as neutral as we can because of the risk of litigation. But suffice to say that there's been pushback, and the tobacco companies have tried to embrace the word sustainability. They've tried to embrace the concepts of the Sustainable Development Goals, which is totally ludicrous given that those goals were developed by the United Nations, and the United Nations has an absolute non-engagement policy with tobacco companies. So there's all sorts of tricky things that they've done, but it won't stop us.
Fantastic. You also had pushback, you said, along the way from your own medical colleagues.
Yes.
Well, where did that come from, and how do you manage it?
Well, I think sometimes in medicine there is a lot of pressure, particularly on doctors who are developing their careers, to do a lot of research and to hone their clinical skills. And of course, that's great if that is the career that you're after and those are your interests. But for me, research was never my forte or never my real passion. And so when I found this issue, I thought, well, hang on, this is something I could get stuck into. And I found that I was working on it without even meaning to work on it, and I couldn't stop thinking about it, and I was tinkering and refining and inventing things. And so it sort of took over me a little bit. And I did get a lot of pushback from people on my team saying, look, stop doing that. You're getting distracted from the real work. Go and do some more research and clinical work. And I was very, very fortunate to have a great mentor in Professor David Ball, one of the best lung cancer doctors in the world and a really very special person in the medical community in Melbourne. And when the very first super fund in Australia moved to tobacco-free, he sent me a very nice email that night. And it said, congratulations, by this action you will save more lives than in an entire lifetime as a clinician. Keep up the good work. And I used that sentence to really help sort of shield me from negative criticism from then on, because I always secretly thought to myself, well, if Professor Ball thinks it's a good idea, it probably is. And so I used it to really lift me up and keep me going over the next few years when there was no guarantee it was going to be successful back then, but I knew it was worth giving it a shot.
Great. Now, you also had advice, though, to medical people, to health professionals, that they actually have currency to bring about change.
Absolutely.
And you did suggest that maybe not even try and be on protest lines. What's your advice?
I think that what health professionals have at the moment is something that the whole world is crying out for, and that is trust of the public and trust from the general person on the street. So we're in a bit of a crazy world. Fake news is everywhere. People don't know who to turn to and who they can rely on. But every survey that's ever been done has really shown that I think nurses are the number one trusted group in the community. Doctors are very well trusted. Health professionals in general are well trusted. And so I think that apart from being a great clinician or researcher or whatever discipline in the health sector it is that health clinicians have applied themselves to, in addition, I would encourage health professionals to use their voice to change things that they see need to be changed, or to nudge things forwards if they can see a better way for a particular issue. I know that due to that incredible trust and respect from the community, more often than not, you'll be able to walk straight in the front door and get a seat at the table with the CEO, or have an opportunity to present to the board, because they want to hear from health professionals who carry the stories of patients, of the community, and often have really direct insight into the heart of an issue.
Now, I'm probably throwing this at you, but we're probably seeing that not in action at the moment, where medical groups are leading the way on declaring a climate emergency, and they're not getting the government on side. What's behind that?
Oh, look, I think it's tricky, but whenever there is a challenge, and I think anything worth fighting for is going to require a lot of effort, and there will be challenges and barriers, I implore people to just find another way. So perfect the sidestep, be creative, be innovative, and go round. Find another way.
A related question was that one of the questions came up today about that the Prime Minister's been talking about secondary boycotts as to shut down protests. You said you don't see that as being an option anymore.
I think it's very unlikely that will go through. I think that the whole world is responding to community concerns about a whole range of issues, and I think that if people want to choose what to do with their money, or choose the clients they have, choose the businesses that they have dealings with, I think that that is in fact going to strengthen, not weaken.
Great. And just final question on tobacco. You said you're still stunned at how little is invested in it. It's not sexy. What's your concern?
Well, the truth is that every day in the world, more than 22,000 people die as a result of tobacco, yet no news story. There's no news story. It's not on the front page of any paper. It's not on the news tonight. It won't be on the news tomorrow. And there is a massive global complacency around this issue. It is old, so people often think, oh, well, it's either been fixed or it's already been covered. And sometimes I go to conferences to talk about tobacco, and people will say, could you talk about something else? Can you talk about alcohol or sugar or whatever? And there's a very nice saying there that was coined by Emily Banks, who's a professor, a medical professor in New South Wales. And I'd like to repeat it here. Tobacco is the new tobacco. It hasn't been fixed. And we need to keep attention and focus right on where it really matters, and that is supporting tobacco control initiatives locally, globally. We've got a massive problem on our hands. It's the greatest health challenge the world has ever faced. We know how to fix it. We just need the resources to do it.
Thank you very much.